My name is Dr. Hannah Bahlhorn, and I work at Ivory Point Dentistry in Vista, California. And today we're going to talk about general care dentistry. So some of the things that I love about dentistry is meeting people for the first time. Whether it's you've changed your insurance or you're just trying to find a place to call your dental home. One of the things that's important to me is to be able to work with my patients towards a common goal. This isn't just me giving all my suggestions, but it's me working with them and saying, how can we make this manageable? How can we fit this in your lifestyle? When you refer a friend or a family member, it also makes it more like a dental family. And that's something that I've always appreciated. I would say a little bit more about me and what my belief systems are is I want patients to have longevity. I want them to have happiness. I want them to have a healthy smile. I always tell my patients, if I'm doing my job and you're doing yours, you won't think about me until you're sitting in my waiting room saying hello for a cleaning. And I think that that's my goal, longevity. I want people to have their teeth for the rest of their life. One thing I always like to tell my patients is that I want your teeth to outlive you. Every patient is truly unique, has special needs, whether it could be something systemically that they're going through or even things financially that they have to consider. And so I like to work together and be that person who's collaborating to make something that is practical and applicable to you as the patient. Why do I have to go to the dentist? People will come in and say, I haven't been, it's been several years, I'm not in any pain. Why does it matter? Do I have to come and see you all the time? And to that, I will answer you this. First of all, it's so important for your overall health. There's so many studies now that are going on that show us that what goes on in our mouth shows in our entire body. The other thing is prevention, prevention, prevention. Prevention is so key to keeping you in minimally invasive dentistry. When we catch something super early, it's a very pain-free, minimally invasive procedure. Now, there are times when that doesn't happen, and when that happens, we also have ways and methods to fix that, but our goal is to try to keep you pain-free and healthy. The importance of maintaining your oral care at home comes from those gentle reminders coming in every 3 to 6 months at your dentist. It's so important that you realize you are part of a team and we're on your team to help support your mouth for the longevity of your life. We want to make sure your teeth are safe, that they're healthy, and that they're functional. We also want to make sure they're beautiful and it's a smile that you can be proud of. How often should you be brushing? Well, sometimes I tell people more than what they say. The average is 2 minutes in the morning, 2 minutes at night. But some of my patients have more dentistry, they've had more work done, and they want to protect their smile. So some of them are brushing also a 3rd time a day. Flossing or using water flossers. There's so many tools at our disposal to partner with you to make sure your teeth last you a lifetime. So my general rule of thumb is brush in the morning, brush in the evening, and if you want to floss after lunch, go for it. One of the things that we're very passionate about here treating at Ivory Point Dentistry is the treatment and the prevention of gum disease. So many people come to the dentist and they say, look at my teeth. But what they're not realizing is that we're also looking at the foundation of your teeth. Because if we don't have the right foundation, those teeth are not going to last you. So one of the most important things is treating early detection of gum disease. And we have all of the tools to do that here at Ivory Point Dentistry. We have all of the technology. We have all the special radiographs and smart technology to help us look and see what's going on there. One of the ways that we do this is by measuring your gum pocketing or the indentations around your gum. We also take your family history, and we also highly consider your systemic disease processes because it really does play a huge role in the support system of the teeth and the surrounding periodontium. When we do that, we can also look if the teeth are ticked. Are they chipped? What's your family history? And it's important that you know that some of the signs of gum disease would be bad breath, getting a bad taste in your mouth, bleeding gums, those types of things. And those are little red flags that something could be going on there, and you can coordinate that with us and we can make sure we eliminate and treat the gum disease according to your personal plan. Thank you so much for taking the time to listen to these videos. I'm very excited and passionate about working with you, and if you have any other questions, please feel free to reach out to us at Ivory Point Dentistry. We're here to serve you.